Hey guys, welcome to my channel, which is Real Homeopathy. So in today's class I'll be explaining about what is curable in disease. So what is curative in medicine? So what is curable in disease? We have to understand what is the thing that we have to cure in the disease form and what is to be done to get cured, so by the particular medicine. So prescription of what is curable in disease and curative in medicine, and the application of the last word to perceive. So what it says here is perception of what is curable in disease and curative in medicine. Firstly, we have to get the picture of the medicine and get the picture of the disease. Get the totality of both the disease as well as the medicine, and the applicable of this, the word to perceive. We have to perceive what the disease does and what the medicine does to the disease. So what is curative in disease? So this is what we have to perceive firstly. If he clearly perceives what is curative in medicine and what is to be cured in disease. So if he clearly perceives what is curative in medicine and what is to be cured in the disease here. Okay. So what it says, to perceive means to see into, not just to look upon with the external eyes, but to see the mind here. So what Hahnemann says in here in Organon of Medicine 6th edition is, so we have to understand the mind of the person. So the mental symptoms are important. So we have to understand the mind of the person. To see means to see tumors, palate, liver, examination of urine, blood, etc. So these are the things which should not be observed, but in overall case we have to understand the mind symptoms of the patient, the mental symptoms or the mind state, the mental state of the person. There is difference between the mental state and the mental symptoms. Dr. Rajan Shankaran says in the Spirit of Homeopathy that there is a difference between the mental state and the mental symptoms. Okay, so that will be seeing in the other sections which I'll be explaining on Dr. Shankaran, the Spirit of Homeopathy book. Okay, so this lecture says that to see means not just to see that the person has got tumors, a person has got liver problem, examination of urine, blood. Oh my god, it is not the that we have to see, but what we have to see is the mind of the patient. Dr. Hahnemann meant disease is not morbid anatomy or pathology changes in organs. So what Hahnemann says is disease is not the anatomical or pathological changes that we have to treat. Next, coming to curable in disease is the symptom totality, is the speech of nature, is not the actual disease but represents the disorder in internal economy. So the curable in disease, what is curable in disease? Whether the disease can be cured, whether we have to tackle the physical symptoms or the mental symptoms or the particular symptoms or the examination what we are doing. So like tumors or palpating or just examination of the blood samples or urine analysis. So not this. Okay. So curable in disease is the symptom. That is, the speech of nature is not the actual disease. Next, coming to the totality is external, which is the manifestation in the tissues, will represent to the physical disorder in internal economy. Something we have to see internal symptoms, but whenever we see the physical symptoms which is manifested at the tissue level, at the external point, so this is a physician disorder. not the bodily disease which is disturbed in the state of the patient's vitality. Okay, not every manifestation here is curative. So not every symptom that the patient expresses is not curative here. Results and ultimates in the tissues. Example, cancer are not curative signs, but those things which are capable, curable of change by administration of remedies are the curative indications. Here, cancer is not, if the cancer gets cured, so this is not the overall healing of the well being here. That is not the sign of the well being. The overall patient's health has to be normal, back to the normal state. So that is the curative symbol in the patient vitality state. So cause of disease is from center, from innermost to the outermost. The disease what is there, cause of disease is from center. The healing has to be from center to periphery, from above downwards. What Herring's law explains to us, from above downwards, from center to periphery, from center to circumference. Okay, from low organs to the higher organs, from the lower organs like skin is not the, it is the least valuable thing that we think, the manifestation of the symptoms here. But what happens, the internal ongoing changes which is there in the vital symptoms, the vital state of the person, so this matters here. Cancer are not curable signs here. Next, coming to cause of disease is from center, from innermost of to the outermost. Center is in Delhi, London, Paris. Center is in Delhi. Okay, London, Paris. Spider is in center and governs his universe from center and forms web around himself here. So spider is in center. But what happens here, the center will be in Delhi, it will be in London, it will be in Paris. The spider is in center and governs his universe from center and forms a web around himself. So you observe the spider, it sits here and it will form a web. So that is how the disease will do. So we have to find who is spider here in our disease for condition. Who is spider and who is making all this govern here, right? So man does not become sick from external things like bacteria or environment, but from causes in himself. So let's take the example of coronavirus now. So many of the people are suffering from certain stress, certain infections, so weak immunity power. So weak immunity power definitely leads to some kind of infections. So what kind of infection it might be? So you have to understand that. So man does not become sick from external things like environment, from cold, from dust. No, we are just treating. We homeopaths should not treat in such a manner here. So whenever we consider external things as in, so these are the external things here, like the bacteria or environment, but from causes in himself. So we have to understand what is the cause now. So the true perception of disease is of this disordered vital economy. So what we have to treat. So what is true perception of disease is the vital energy that we have to treat. The mental state of the patient will reach us to cure. The mental state of the patient will reach us to the healing state of his vitality. To perceive what is to be cured in disease, proceed from generals to particulars here. So, to perceive here what is to be cured in disease proceeds from the generals to particulars. So, that is a state, that is the thing that happens which goes from generals to particulars, not from particulars to generals. So what a Dr. Rajan Sankaran says in the spirit of homeopathy again here is, the particular will never give a result or the complete healing or the complete cure. It won't give us unless and until we consider the generalities, the mental symptoms of the patient. Okay. Example like measles, cholera in epidemic cases. So these are the things that goes from general to particulars. Physician, after examining several cases, gets idea about symptoms of disease in all patients called as pathognomic symptoms, and which are rare are called as peculiar symptoms, constitute symptoms of the patient. So physician, after examining several cases, gets idea about symptoms here. So we take the case, we understand the patient, we just interview the patient for some while, and what happens, we take the symptoms of the disease on the patient, and we take a pathognomic symptom, we take PQRS symptoms, we take rare symptoms, okay, which will constitute the totality here. So don't give medicines on diagnosis and past experience. So every case is a fresh case. Nowadays what is happening, if there is a varicose veins, so these are the particular remedies that we give to all patient, and if there is piles or hemorrhoids, so these are the particular remedies that we give in clinical practice, but that is not the actual homeopathy. So what happens when you give homeopathy in that way, that is just a safer side of treatment. There is no difference between allopathy and homeopathy once you do that, right? Why I'm saying you is that almost people are coming to homeopathy just for fast results, not for a complete results, and as an alternative that it doesn't have a side effect. So we homeopaths, what we try to do is just give them a complete relief, fast relief, and make the case complicate and make him more worse, and then make him return back to homeopath. And what again people say is that homeopathy is not slow, but again I'm suffering from this, homeopathy is not permanent. So what people say is one or the other thing. People say either homeopathy is slow or either homeopathy is not permanent. So what we have to be true to the system. Next we see the curative indications of disease are patient symptoms, that is the individual characteristics. We have to approach the patient on the individual characteristics, individual symptoms of the patient, not considering all patients as same, not considering all the vitality of the patients are at same level, but some of them have the lower level, some of them have the higher level, some of them have a 0.01, some of them have 0.04, so some of them have 0.2 only, some of them have 1.2. So these are the different frequency levels of the intensity, so that we have to approach to the patient and then give the potency. Then we have to select the particular remedy, right? After remedy based on the patient's symptomatic this thing, and based on his tolerance level, his age, all matters to do the repetition and to select the potency here. So not just selecting the remedy is important unless and until you understand the potency level and also the repetition level. Okay. So what is curative in medicine? Coming to the point, study the homeopathic Metra Medica proving image of medicine by action of human race on the plane of mind and body. Understand the nature, homeopathic Metra Medica pura hevo. Okay, understand the nature of the miasms, the chronic miasms. I have explained there are sections which I have taken lecture on miasms and the SORA, the clinical presentation, how the patient comes with the symptoms and how we have to recognize the miasm here. Dr. Hahnemann collected symptoms of patients and arranged in schematic plan. He proved antisoric remedies on different provers, formed a collective picture of all, as if one person gave all the symptoms of various organs. So what Hahnemann says here is, he proved homeopathic soric remedies not only on one age or one person, but on different age groups, different sexual characters, and different climactic changes, different places, made many provings and gave it as a presentation of the same one remedy. So, this image of disease is perceived by Dr. Hahnemann in many patients as parts of miasms. So, whenever you take the whole case of the person, you'll understand you have to dissect the miasms, as Dr. Saptarshi Banerjee says. Saptarshi Banerjee, what he says is, you have to dissect the miasm, understand the miasmatic prescribing. There are certain lectures which are going on miasmatic prescribing by Dr. Saptarshi Banerjee. So you can go through that in YouTube again. So aphorism 3 teaches, it looks towards making the homeopathic physician so intelligent that when he goes to the bedside of the patient, he can perceive the nature of disease, the nature of remedy. He sees the disease, not see, but perceives, understanding the internal nature of disease and its remedy. So firstly, we have to perceive here. Perceive. So we have to perceive this thing and then understand and what is to be cured in the disease, and then you'll definitely get the result to cure. So in order to get more updates on my channel, so subscribe to get notified, and don't forget to like, comment and share the homeopathic medicines lectures to get more updates on that, and to not miss the single video. Thank you.